So a lot of people with shoulder pain will Google it or talk to a provider, and one of the main things that they'll say to do is work on your external rotation. So typically they'll YouTube that or go to the gym and start doing external rotation, and they don't get a lot of results out of that. And so I want to walk you through a couple reasons why that is, and then how we can make external rotation actually more effective as we get stronger. So for starters, what I want to do is I want to talk about the basic way to do it, which is this side-lying external rotation that you see in all the videos and that you do in most of the clinics. But I want to explain the difference in the basics and how to do it effectively. So for starters, what most people do is they will sit like this, and they'll kind of rotate their shoulder like this, and then this is too easy, so they'll go up to like a 10-pound weight. You know, that's tiring, but then they don't ever get any pain relief. Well, what we're doing here is we're really kind of using our shoulder blade as well as kind of our, upper arm to help with that motion. And a more effective way to do that is actually take a towel, pin it to the side, and then take your shoulder blade and set it backward. So pull it all the way back, don't let that move. You can even keep your finger here for an added benefit. Now what we're going to do, we're going to have a smaller range of motion. But what we're going to do is we're going to go up and back down. You see I didn't go as far with the weight because I ran out of room here. If I want any more room, I'd have to kind of open up or move my body. So now I'm just going up and down, nice and slow. I'm squeezing this towel to my side so I can't pull it out. I'm squeezing my shoulder blade back so it won't move forward. Now it's starting to burn, and this is just a 2.5-pound weight. So this is significantly harder than doing it this way with like a 10-pound weight, because I'm isolating those external rotators on the shoulder blade by getting the shoulder blade pinned, squeezing this down to our side, and just simply spinning the upper arm or the humerus in the socket, which is that rotation component. So up and down, slow and controlled. Now, a lot of people tend to do that until they're good at it, and then they'll do 20, 25 reps and take a break. When really what we want to do there is if we can get to 12 to 15 reps, even better might be 8 to 12, then what we're going to do is we're actually going to make it harder. We're going to go up to a 3-pound weight, 3.5, 4, 5-pound weight, versus just adding more volume in. When you do those lower rep schemes, you're building more strength. You're still building some what we call hypertrophy, which is where the muscle's getting bigger, but you're building strength in the muscle, which is really important for keeping the head of the humerus or that upper arm in the center of that shoulder ball and socket joint. So the muscle has to be strong enough in order to do that. Otherwise, it starts to slide around. That's where we get pinchiness, pain, that ends up in a cortisone shot to calm things down, right? So that's really the basic way to do external rotation. If it's done correctly, it's actually really effective. If it's done incorrectly, then you're not really getting a lot of benefit out of it, and you'll just spin your wheels over and over. Now, the other thing to say is if it's done correctly, it's effective, but it's really just it's the cornerstone or the starting block. You really have to add in some more difficulty in order for that to actually translate into regular life, especially life in the gym or in a sport. So I'll make a video talking about that as well, so make sure to check that out.